that we don't exclude them. It's the mothers of these young girls also need to have the attention of understanding what menstrual hygiene is. Extremely important on the other side is menopause, which has never been addressed. Definitely not the NGO sector, just glossed over and considered, oh, that's, you get over it, sort of a kind of issue. And unfortunately, a lot of women are suffering with problems due to some are lucky, but many in India are not lucky. And they have a lot of health problems and a difficult time facing it. So I think I'm really glad that this project gave us an opportunity to address these issues. And through this project, we have learned a lot from the community. Understood what they know, what they don't know, and how we should now move forward. Literally, it's like a pilot that has given us lots of ideas, and therefore, not only can we go forward maybe with a bigger partnership, but also look at how can we advise and help the influence policy. NGOs only work at a small scale, but if we want this to impact on the many more, it has to be able to help say where the government can take it up and scale it to a larger scope thing. And it's the voice of the people in the community who can reach there. And it's through the NGOs that this can move.
We have a lot of support from the panchayat system for these kind of programs. The thing is that if people working for this have that exposure, how the local government can contribute to this program, it will be much worse. So that's one thing we need to take care and think about these kind of things to expire in the future. Second thing is that advocacy is a very important point in this. The advocacy at different levels, like at the local level with the school teacher, right? And also with the Gram Panchayat, the local government, right? The local government to state and a Panchayat development officer who is supposed to be chief secretary of the state board. State board chief secretary is chief secretary of the local government, right? And when I approached them, I said, look, my dear friends, I want some resources to sustain this project. Can it be given from Gram Panchayat? The immediate answer is, there is no money, sir. Thing is that there is money, but the problem is they don't know how to relate, this work with the money they have. Relate. But some kind of letter from this, the district local government chief, an IAS officer, big officer, right? If I get a letter from him, I said, you don't need to be from anybody. The local government act speaks that it can design programs and plan it. And they don't have to go to any doorstep to knock the door for money. But thing is that they don't have that kind of awareness about these things. So that's why my experience that needs to involve different stakeholders. First, you need to do a mapping of state to get some kind of resources to the project to sustain by the government. There are 5 ministries involved in this. We need to go to 5 ministries, principal secretaries and talk to them. One is the Women and Child, the other is the Finance Ministry, the Health, the Panchayat Raj, the Finance Information Broadcasting, who do a lot of awareness to people about. These 5 ministries involved. If you talk to those principal secretaries of 5 ministries, something might happen. But waiting
more from last 3 decades is going up. Regarding this menstrual hygiene awareness program, I think during 2014-15 we have implemented a pilot project in 3-4 clusters, then 15, 16 and 17, 18. That's when it extended to 3 states where Mayada is working in the part of the 3 states, and almost 2.5 lakh SG women are covered to create awareness on menstrual hygiene, and also similar number of adolescent girls where personal hygiene and as well thing the health. After 16 years in collaboration with Health Family Department of Health Family Welfare Services for the Bangalore, we are we are producing a lot of programs on women health, TH, then this menstrual hygiene, personal hygiene, and adolescent hygiene.
Within the space, because small 10 by 10, 10 by 6 houses are there, and that's where this menopause, when we were conducting awareness on menstrual health and management. We had a team who was trained in Ecofam Pondicherry, and she was well versed with that. They were okay with this menstrual health and management. When it came to menopause, they have not heard about what it is. After 40, 50 years, these are regular because of our health, BP and other things. And they were not aware of how to manage whether it is mood swings or whether it is the management of their personal hygiene, those kind of things. When they heard about this, oh, is there something called menopause? And then they sat, and when awareness was given, they said it was very useful, and now they understand why a grandma behaves in a particular way, or why a woman who has crossed 55 or 60 behaves in a particular way, given in the family situation. And they said it is very useful because we were not aware of these things, and then now personal hygiene is maintained, and they know when that particular period that they're going through what to do, what their emotional, mental and physical well-being. So what food to eat, nutrition, all these aspects were touched upon.
They were saying during this menopausal stage, the physical intimacy, they cannot have it in the family with the husbands. So they are finding it very difficult to manage. Lot of quarrels come, lot of disagreements come, and then they also say men have some other partners during that time. So how do they have to cope with this and manage this condition?
Okay, if it is, if the relationship is not deep, not psychological bonding, this can happen. Okay, it is, see, up to 35 or 40, it is a kind of attraction, physical, all that. Then it grows into a bonding and a close friendship. And here one can be the inadequacy of the women who feel that I am not as feminine as I was before. And then what happens is it is one's own inadequacy that leads to this kind of problem. Well, men, it can be a suspicion or it can be a reality.
There's also this aspect when we were working with HIV and gender, increase in commercial sex workers. Clients have increased. Many of them have expressed that the wife is going through menopause and they are not interested in sex. The another reason for the increase in commercial sex work. They have heard that.
No, as I said, it can be a reality or it can be a suspicion.
Feel that women can feel uncomfortable, bringing up some issues, in front of other men folks. So sometimes what happens is like we send the men out, and eventually the education doesn't go to them. That's one of the biggest opportunity. So.
5 years, children are become youth, some are married. Some of the girls married and not married attended a session on reproductive health care. They came back from the meeting and said, this has to
We go through a kind of a comprehensive understanding on gender and gender sensitivity. Now, in the church context I come from, we carry forward our orientation from the seminary and we try to take it to the congregation, not just in matters of religiosity or spirituality, but also in terms of general people understanding and people groups. Now,
Working with the other NGOs and institutions for resources as well as knowledge and skills, so that mental health aspect of our reproductive age group, both adolescents and women, men are taken care, and peer groups is as our very influential.
Period are facing the lack of identification and acceptance. So these were the discussions we have, and we thought to propose, our group thought to propose on creating a safe space and creating a open discussion on gender in all the aspects of life, like in the organizations, through religious groups and community networks, volunteers. Then we also plan to have a top-down approach.
Being and emotional well-being should be touched on. All of these different stakeholders. We have to be in social justice and like public health work. We have to be multilingual, right? You have to speak the language of all these different stakeholders because everybody wants something different, right? So we have to have data, and I'm not just talking with all of the partners. And so thank yourselves if you are a partner in this, because GHA just played a small part, right? The bigger part was all of the partners and the partnerships that happened. And we talked about this earlier on, and it's been kind of a theme throughout, that this type of work does not happen without strong partnerships, right? And even to move it forward, we have to have strong partnerships. And those partnerships are not just about one aspect, right? It's about the coalescing, right? In terms of thinking about what are we getting out of this, what are we giving back, right? I had conversations, we were talking about the community, the strength of social justice work, which is what we do, comes from the community. Because the government is not going to listen until the community, there's a swell. And it starts with one community and then the next community, which is what we've been talking about. How do we move this forward, right? Community by community. And I really believe that this is going to be a powerful thing. These two programs, or three, however you want to count them, are really, really powerful programs. You can see some of the great results, but to talk about menstrual health and hygiene and gender sensitization, these are not issues and challenges just in this community or in this country. It's happening in others. So global health action, and particularly in countries in the global south, global health action works with countries in various countries in the global south, including right now we've been working with several partners in Kenya. And I can tell you we have some partners there that are working on the same issue. But I don't know if they've done a program or an intervention like this, which is why we have to publicize and publish the works, right? The menopause management. My supervisor, our president and CEO, as we were looking at the results of the program on menopause management, she said, oh, this is something that we need here in the U.S. as well, because they don't talk about menopause management, right? Even in the U.S.